On to something that many couples face in their quest to expand their family, infertility. Here to talk more about this is Dr. Andrea DiLuigi, a fertility specialist with the Center for Advanced Reproductive Services at UConn Health Center. Good morning to you, Doctor. Thank you so much for coming in.
Good morning. Thank you so much for having me.
So we're going to start with the basics here. How big a problem is this? How common is it that couples struggle with infertility?
It is a very common problem. At least 7 million Americans have the diagnosis of infertility. That's 1 in 8 couples.
And so there are a lot of reasons why. But before you get to that point where you find out that you're one of the 8, how long do you wait before you start really thinking about some of the fertility options out there?
The recommendations are really to consider seeking help after 1 year of trying. But if you're over 35, we really like to set that limit to about 6 months.
And many couples, despite the fact that there are options out there, they don't access care. Why is that?
I think there are many reasons, but we have looked at this and we have realized that some of the more common reasons can be anxiety, just a fear of seeing a provider, a fear of having testing and potentially receiving concerning or upsetting news. And another very big obstacle for some people, I think, is financial concerns.
Right, and there have never been more options when it comes to health and also finances. We're going to get to finances, but I want to hear more about the Toe in the Pond initiatives. This might give people that little bit of hope, the glimmer of hope, like, okay, maybe there is something I can do. Let's start first of all with the patient webinars. What is that?
We have an exciting series of patient webinars. These are educational lectures on our website. They're given by one of our board-certified physicians, and they're actually interactive, so it's really nice. Patients can log on from the comfort of their home or office and type in questions and have their answers sent back to them in real time.
Oh, that's
and
great.
These are great topics. Basics about infertility, stress and infertility, really helpful topics.
Because sometimes it can be just that easy, and you hope that's the case, but sometimes it's not. So there are free fertility consults, right?
Absolutely. This is another new program that we're offering, and we're very excited about it. And what this is the opportunity to speak with the physician over the telephone for about 15 minutes and to discuss your history and potential testing and treatment options that are available.
And I want to squeeze this in because this often is the biggest stumbling block, the financial side of this, but there are some options for that as well.
Yes, we have several insurance coordinators that work very hard to help patients through these issues. One of the first steps is to have the coordinator speak with the patient's insurance company to see if they do have indeed coverage for the services. And if they don't, we have some great new discounted package plans where we bundle services together to really make an effort to save patients money and make the services more affordable for people.
So there have never been more options, never been more help. Time is of the essence. If you have these questions, you want to talk to the clinic or some of the doctors about it, now is the time. Thank you so much for coming in and sharing that.
Thank you so much for having me.
All right. I hope we helped some of our viewers this morning.